The Knowledgeable Provider podcast is educational, entertaining, and not the same as medical training. The information presented here should not be used by anyone to diagnose or treat any medical condition in themselves or others. If you need medical advice, go see your own knowledgeable medical provider. Opinions expressed on the podcast are solely those of the people expressing them and are not necessarily representative of any other entities. Other than lunches at the office, I do not receive any sort of compensation from pharmaceutical or medical device companies. But I could. Big Pharma, where you at? But, alas, I have no financial disclosures. Okay, on with the show. Hey, welcome back to Knowledgeable Provider Podcast. My name's Jody Marks. I'm your host. This is a Just Me Talking episode. I attended the Pri-Med conference in Nashville earlier this week. And in the past, I've done full recap episodes when I've been to conferences like that. And mostly they're not very popular, so I think I'll do one next time on the new AHA guidelines. That may be the most interesting, applicable thing from the whole conference that more people might care about. I'm not being paid by Pri-Med, of course, but I have been very impressed with Pri-Med in general. If you're not familiar with them, they're a continuing education company that is geared toward CME for primary care providers. They have a lot of online CME stuff that you can do. They have podcasts. I really like the Frankly Speaking About Family Medicine podcast, which you can earn CME by listening to. And then they put on these big regional conferences all over the country. I've only been to the one in Nashville, but I've been very impressed at the caliber of speakers that they have. They're all physicians, and they're a pretty good mix of academic and clinical people, and they're very accomplished people in their fields. The cardiologist that's come both years that I've been to talk about guidelines is on the guideline committee, so it's pretty cool to hear from people like that. I love hearing her perspective on how the guidelines are developed, too, because it's interesting to hear someone stand there and say, oh yeah, this got in the guideline because two people were fighting across the table and couldn't agree on it, so we just compromised and settled on this. Maybe I think of guidelines as being, handed down from the mountaintop, but it sounds like it just comes down to a bunch of people sitting in a room arguing about evidence and professional opinion and whatever. But it's very interesting to hear that kind of higher level perspective on what's going on behind the scenes. But they cover a great range of topics at these Pri-Med conferences. They're very, very good about keeping it absolutely on time. They start on time, they finish on time. There's a little light on the podium that you can see from out in the crowd that turns red and starts flashing when the speaker's time is up. And they have moderators that kind of like show up on the stage and will even interrupt the speakers and be like, all right, it's time to quit. They're really long days. The presentations start at like 7:15, 7:30 in the morning and go until 5 or 6 in the evening. And of course, they have a bunch of vendors, pharmaceutical companies and medical device companies and stuff with tables set up that I refuse to talk to any of them, but they're there for if you're interested in that sort of thing. And it's not especially expensive. It's like, I want to say $60, $75 for a 2-day conference. You can get, I think, 13 CEUs out of it. So it's a pretty good deal. Check out Pri-Med if you haven't. Hey, Pri-Med, feel free to send me some money so I can have a disclosure like your cool speakers. So I forgot to charge my laptop before the first day of this conference. And I'm like, oh no, what am I going to do? How am I going to take notes? And I remembered that I learned how to write when I was a child. So I sat there through the whole thing taking notes in outline form in a notebook. And it's funny, right, that I sort of feel out of place doing that now, or awkward, because I made it through all of high school and college by sitting in lectures and taking notes and then studying my notes later. The second day I charged my laptop, but then I kept taking notes in the notebook anyway because it was kind of nice. But I had this thought, and I wrote it down in my little notebook and put a star by it. It says, thought, : a lot of medicine is managing or accounting for your own ignorance. Because I was sitting there in one of these classes, and I was thinking about how when I'm talking with a patient about anything, it feels like there's sort of a filing cabinet in my head. The patient hits on whatever topic, and in my head, I'm pulling out the drawer and the file folder that has information on whatever topic they're talking about, and I'm flipping through it and going, all right, what do I know about this? But at the same time, and I think this is probably true for damn near everything we talk about, you have to think about, what don't I know about this? Because medicine is so huge and vast, and there's so much information out there. There's just no way that one person can know everything there is to know. There's just no way. Maybe people with bigger brains than mine would argue with that. Maybe there are people who know everything there is to know, but I just can't see it being a possibility. And I feel like one of the most important things we can do as medical providers is to never forget that there are things we don't know. When I was a paramedic, and obviously I don't mean this as any sort of derogatory statement toward EMTs, paramedics, EMS providers, I love all y'all. half the time I wish I was still out there doing that with y'all. So I'm only speaking for myself. I'm speaking from my own experience. But my experience was when you go to EMT school, paramedic school, you learn a lot of stuff. It's a pretty intensive program because when you get done, you have to go out into the world and handle very serious emergency situations. And it's pretty clear that they want to drill you on the most important things to get you ready for that, as opposed to nursing school, where the goal is to give you a very broad overview of a lot of things and get you to the point where you can pass NCLEX. And then everybody kind of knows that when you get to where you're going for your first nursing job is when you're really going to learn how to be a nurse. That's just an accepted thing in nursing. But with EMS, they kind of make you an expert on the most serious things that you're going to have to deal with. So when you come out of paramedic school, and again, only speaking for myself, when I came out of paramedic school, I felt like I knew everything there was to know because I know what to do for a heart attack and a stroke and a trauma situation, and I can run a code and I can handle all these things that I was trained to handle. So great, give me the ambulance, let's go. I know how to do everything. And then I spent my EMS career trying to hammer square pegs into round holes because, of course, mostly what you deal with is a bunch of stuff that is not the most serious stuff that you're trained to deal with. And that becomes a very significant source of stress for EMS people. Like, hey, I'm trained to handle the worst of the worst, and I'm out here dealing with just a bunch of BS, almost nothing at all. What's going on? And then as I've gone along in medical training, medical education, I've come to understand how narrow that training is. Yes, you're an expert on the things you're an expert on. Paramedics know so much about EKGs and cardiac stuff. I would say second only to cardiologists and mid-level people who work in cardiology because they get so much training on that stuff. But then they don't get any education or training on anything else outside of that. So as a paramedic, you're an expert on the things you're an expert on, and you don't know crap about anything else. And looking back on my time as a medic now, I realized that I never got to the point of being a mature, thinking care provider as a paramedic. I think I spent most of my career going, okay, which protocol applies here and what are the rules I have to follow? Instead of, let me just think about this and understand what the right thing to do might be. And maybe I'm not giving myself quite enough credit there, but I know there were lots and lots of times where I did things because that's what the protocol says you're supposed to do, even though the other side of my brain was like, this doesn't make any sense. You know, giving nitro to a young person having chest pain is a great example. I actually wrote a little article about that several years ago that was published in EMS magazine. I'm sitting here Googling it, trying to find it. I can't find it, so it may not be available out there anymore. But I wrote specifically about handling chest pain patients and like, how am I really supposed to know if a patient's having a heart attack or not? How do I know when I'm supposed to follow this cardiac protocol and when I'm not? And that sounds really dumb. Even right now, coming out of my mouth, it sounds a little dumb. But when it really comes down to it, how sure are you that somebody complaining of chest pain is not having a heart attack? There are all these tests we can do. We have our Gestalt, right? Our clinical impression. In my situation where we know all the patients, it's like, okay, well, this person comes in every 2 weeks complaining of chest pain, so more than likely not a heart attack. Or this person is really young and healthy and they're not having a heart attack. But can you ever say 100% for sure that somebody is not having a heart attack? You really can't, right? Even at the hospital, they keep people for hours and hours and hours and watch their troponins and see how they're trending just to make sure if it's not obvious. So when I was a medic on the ambulance, my thought was always, okay, I have these protocols that I'm supposed to follow. I'm at the absolute bottom of the totem pole as far as having a leg to stand on if anything goes wrong here, because obviously I'm going to be the person who gets thrown under the bus if I screw this up. And I make $10, $12 an hour. So is it really worth me taking any kind of risk and going, oh, this patient ain't having a heart attack, and then showing up at the hospital and they really are, and now that's on me? So my feeling about that was, well, you know what? I'm going to follow the protocol. Like, I'd rather get in trouble for dropping somebody's blood pressure a little bit unnecessarily with nitroglycerin or giving him a headache than for not realizing somebody's having a heart attack and not following the protocol. Because which way is going to get me fired or disciplined or whatever? And I would err on the side of, if I really wanted to deviate from the protocol, I'd call the doctors and ask them, because I saw no reason to take that liability on myself. But then the other side of my brain, of course, is going, this is stupid. You're wasting your time. You're tying yourself in knots with all this anxiety and worry over nothing, because this person just had rattled off that they had some chest pain and probably they're not having a heart attack. And this is how clinical decision making in medicine always goes. You feel like you're never sure, 100% sure about anything. It's so nice when a patient comes in and says, hey, I feel like I have a urinary tract infection because this feels just like every other urinary tract infection I've had. You're like, oh, yes, here's your macrobid. We'll look at your urine to make sure, but have a good day. Or when somebody has shingles that's really obvious, it's like, oh, this looks like the textbook. It sounds like shingles. Here's your valacyclovir. I hope you get better. And there are instances like that, of course. There are certainly instances where you're more sure about what to do, more confident about what's going on. But for the most part, we live in a gray area. We swim around in this area of just kind of going with what's the most likely thing, but never really being sure about it. And it can be maddening. So, anytime something comes up in the clinic, what I'm having to take into account as I'm listening to the patient and responding to the patient is how much do I really know about this? And I think one of the most important things we can do as medical providers is to always be honest about that. It's very tempting to sit there with a knowing look on your face and nod your head with your stethoscope around your neck. I'm not a white coat wearer, but if you're a white coat wearer, wrapped in this cloak of your hard earned white coat and act like you always know 100% what's going on. And again, only speaking for myself, I don't. And as far as I know, I got a decent education. I went to real colleges for all of my EMS and nursing and nurse practitioner training, and I have a lot of clinical experience, and I don't know what's going on sometimes. So I have to believe that most other providers experience the same thing to some degree. Obviously, physicians get a lot more training than nurse practitioners, but I have to believe that there are a lot of times when even physicians feel the same way, as evidenced by how many stories I've heard, patients I've talked to about their experiences where they go from specialist to specialist to specialist and nobody can figure out what's wrong with them, or we read about or hear stories of diagnoses being missed. Of course, there was that big paper a few years ago about how medical errors are like really the number one cause of death in the United States. So obviously, somebody is making mistakes out there somewhere. I have to believe I'm not the only person who feels some level of uncertainty about what's going on at times. And I think a big part of maturing as a person working in healthcare is being able to admit that, first of all, to yourself, and second of all, to the patient. It does take a while to get comfortable looking at somebody in the eye and going, yeah, I don't know. I don't know. I've never heard of that. I don't know. I don't know what's wrong with you. I don't know what's going on. I don't know what we should do next. And especially when you have relationships with the patients, which I do now going back several years. So I feel very comfortable with these people. I know these people, but that can be a double-edged sword because now I extra don't want to disappoint them. The ones that I think, oh, I wish these were my grandparents or my parents. It's really hard to sit there and go, yeah, I don't know. Thank you for putting all of your faith in me for all these years. And I have no idea. I don't know. I've never worked in any other field, any other profession, but I wonder if other people go through this. I wonder if when engineers are designing things, half of their brain is going, I wonder if I really know enough to be qualified to design this building, or I wonder if I really studied whatever materials dynamics enough to understand how to put all this together. For some reason, crane operators pop into my head. I don't know why. But I wonder if you're a crane operator and somebody's asking you to pick up some kind of thing you've never picked up before. I wonder in the back of your mind if you're like, I wonder if I have enough training and experience to move this thing that I'm being asked to move, or move it in the way I'm being asked to move it, or whatever. So I don't know if you have any input on that, if you've ever worked in a field other than medicine and you have some experience with considering your own ignorance, I'd love to hear about it. Because I imagine that's not unique to medicine. Every time you see a picture of a law office, a lawyer's office, they always have shelves crammed with law books. So I assume they use those to look things up. And certainly there's some kind of electronic reference that they have access to. But it's just interesting to me. I asked Open Evidence if there are any studies looking at how physician or provider overconfidence could be related to medical errors. And it spit out several different studies that show that overconfidence is linked to diagnostic inaccuracies, management errors, and patient harm. And I'll link to that list in the show notes for you if you want to take a look at some of this. For the most part, I think people appreciate it when you're just honest and say you don't know. I don't usually get a lot of pushback or incredulous looks like, what do you mean you don't know? Mostly, I think people trust us and come down on the side of, well, if you don't know, it must be complicated or it must be difficult or it must be uncommon. Hopefully that's the case. And I think most people are pretty down with the whole shared decision-making thing where I'm not the omnipotent figure in the room that you just have to do what I say. It's more of a collaborative, what are you comfortable with? Here's the information I know. What do you know? What do you think? What do you feel? Let's figure out a plan that works for you. There are definitely some people, and one of the participants at the conference I just got back from mentioned that in one of the Q&A sessions, how some people don't like the whole collaborative decision-making model. They would rather just be told what to do, and often it is older people, and that's probably been my experience as well. But there certainly are some people that are like, no, people say you're the doctor. Of course, they know I'm not a doctor. My patients know I'm not a doctor. But they will say that, "Well, you're the doctor, you tell me what to do." And I will just make a recommendation and give my opinion in that situation. But I really am more comfortable with the whole collaborative process because I want to hear how you feel and what you think and what's going to work for you. Because I can yell at you and tell you how to do all this stuff and write a bunch of prescriptions for things that you're not going to take, and that doesn't get us anywhere. I'd rather compromise and come up with a plan that you actually are going to be okay with and follow rather than ignoring as soon as you walk out the door. So with overconfidence, I have to imagine that it is often comforting to people if they go to whoever, Dr. Smith, and Dr. Smith strides in the room and goes, "Okay, well, here you have ba 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 ba, and here's what we're going to do about it, ba 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 ba," and the encounter's over in 2 minutes. And hopefully Dr. Smith's right. But I bet there are a lot of times where Dr. Smith is not right. And if they had taken more time to listen and think and pick up on things, they probably would have been more likely to be right. I am much more of a listener than I am a talker. When I have students with me that are shadowing me, standing in the room with me, I can feel them getting restless because I'm taking so long listening to the patient. Maybe I've said this on here before, but when I did my ER rotations with past Knowledgeable Provider podcast guest April Clar, who's wonderful, I could feel her shooting like lasers into my body with her eyes when she was having to stand there listening to me interacting with patients in the emergency room. I don't think she ever said anything, but I could tell she was like, "We have got to get the hell out of here. Stop. And I really want to listen. And I'm very, very fortunate to be in a situation where the schedule's not crammed so tight that I can't sit there and listen to people. Because my experience has been that more often than not, if you just let the patient talk, I know that's like against all of the advice, right? It's always you have to guide the conversation, you have to cut them off, you have to make sure you're going blah, 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 blah. But my experience has been that you really don't. If you just let the patient talk, most of the time they will tell you the answers to the questions you were going to ask them, and they will do it in a reasonable amount of time. There are those people that you have to cut them off, or you have to get up and leave the room at some point, or they will keep you there all day long. But that's not most people. And I can't even count the number of times that I've picked up on some little detail that somebody said because I was allowing them to continue talking and I was just sitting there listening and they threw out a detail that was like, "Oh, that changes the whole thinking about the whole thing." Or, "Oh, there's the important thing that we should have been talking about." Or, "Oh, there's the answer." Or, "Oh, there's the reason why we need to change our approach because that doesn't fit with this whole idea that I had been building before." So I guess that's the message at the bottom of all this, is that it's important for us as medical people to never assume that we know the right answer, never assume that we have all the information that we need to make a decision, and we have to keep learning, we have to keep listening. Gosh, stuff changes so fast. And with everything being marketed directly to patients, a lot of times people will come in and ask me about things that I have not heard about yet because it's just missed me, even though I try very hard to keep up and stay current and learn about new things. So there's the take-home message. Just remember that you're not all-knowing, nor should you have to pretend to be. I heard somebody on maybe it was the Curbsiders, some other podcast saying that ChatGPT is definitely a better doctor than you with the AI coming. And there was a great presentation at this conference about AI in medicine. The speaker's name was Dr. Peter Lynn. He has a lot of cool things to say about all the AI tools that are available to us to help do our job. I'll put a link to some public talks that he's given. He's a very interesting guy. If you're interested in that, you should definitely look him up. But if you have used AI for anything at all, you know how powerful it is. You know it knows everything and can come up with everything instantly and have access to a lot more information than your little brain does. But it's not a human. It does not have human judgment. At the end of the day, they do not think. They're not sentient. They're just going by the likelihood of whatever the next word is supposed to be. That's what it boils down to. So we're never going to outsmart AI that's coming down the pike, but we do have our brains and our judgment. And a big part of, I think, being a reasonable clinician, a reasonable medical person, is to recognize your own limitations and never take it for granted that you 100% know what's going on. I feel like I'm rambling now, so I'm going to stop talking. This is a very interesting topic to me. It's very interesting to me to examine how our own thought processes and our own psychological makeup and how we think about things ends up impacting the way we care for patients. That's always been very interesting to me. If you have any thoughts, if there's anything you want to share, any other perspectives you'd like to be heard, please get in touch. If you haven't bought my book, Crooked Creek Serenade, it's very much out there. It's available in ebook, paperback, and audiobook formats from a slew of different retailers. I've decided to really try and push this and see if I can get it out into the world and see if I can get some people to buy it. So I made a whole separate Instagram for my writing. So if you're interested, it's Jody Marks Writes, JodyMarksWrites on Instagram. If you don't care about the book, but you like me and you want to support me, just go follow my Instagram page or go find the book somewhere and give it a 5-star rating. Anything you can do to help me get this out there is much, much appreciated. I don't like being obnoxious. I don't like promoting my own content, but between this podcast and my little YouTube videos that I've been making for years, I know how bad it sucks to feel like you're just yelling into the void and nobody's listening, nobody's paying attention. It would be nice if people would pay attention to this book that I wrote because I'm very proud of it. I think it's very good. And it'd be nice to make some money off of all this stuff that I'm doing. So please go buy it. Tell your friends about it. Follow me on Instagram. Share my posts. Do all that stuff to help me out. Same thing with the podcast, by the way. If you've never given it a rating or a review on whatever platform you listen on, please do that. That's very meaningful and very helpful. I decided to shut down the Patreon because it wasn't really worthwhile. I wasn't paying attention to it anyway. We had a grand total of 2 people who were signed up for it and giving me money, which was much appreciated. But I just decided it wasn't really worth that anymore. So you ain't paying for this content. I know that all but 2 of you have never paid me a dime for any of this content you've gotten from this podcast. So if you've never left a rating or review, it's time to do that. Unless it would be bad, then you can listen for free. I don't know why you'd still be listening, but you keep your opinions to yourself. All right. Well, thanks for listening. I hope you enjoyed this rambly, navel-gazing sort of episode. I hope you have a wonderful week, and I will talk to you later. All right, that does it for this episode of Knowledgeable Provider. If you're looking for more content, check out our YouTube channel and our Facebook page. Remember, all of those ratings, reviews, likes, follows, and subscriptions really do help the show, so please take a second and do those things to help me out. If you have a request for an episode topic or if you'd like to be a guest on the show, I'd love to hear from you. Email me anytime at thekppod@gmail.com. That's thekppod@gmail.com. Thanks so much for listening, and as always, stay safe, take care of yourself, and take care of your patients in that order.